welcome Dr. Marni Wiseman to our interview series, Remote Reflections, Dermatologists in Action. And this is a bit different in this case because Dr. Wiseman, Marni works in a city, but also does some rural outreach. So Marni, tell us a little bit about where you practice and how long you've been in your community and what kind of outreach work you are doing in smaller communities.
Oh, thank you. So I practice in Winnipeg, Manitoba, and I have been practicing for 23 years now. And I also do outreach into smaller rural communities, but also I do outreach into our high north. So we have a large community up in northern Manitoba where I also do rural outreach. So a number of years ago, I found that there was some need for outreach into our rural communities, first of all. And so what I did is I went out there and I started doing skin cancer clinics. And initially, they're volunteer skin cancer clinics, and the doctors were very excited. And I started doing them in one location called Portage La Prairie, and it was not too far from Winnipeg, but certainly not urban like Winnipeg. And they're very excited and had lots of questions and consults, and I always piggybacked it with some education. And it became very obvious that there was a need for not just education, but actual specialist services out there. So I actually spoke to the doctors there, and we actually put a narrowband UVB box right into their clinic so that the patients in that community could access it. And similarly, a few years later, which must have been now over a decade, we did the same thing in another community, which is a slightly larger community, but further away from Winnipeg, over an hour and a half drive. In a community, the Morden Winkler community, where they also have a huge patient population with very limited specialist access. And similarly, I started doing skin cancer, just volunteer, actually initially through the Canadian Dermatology Association, doing some skin cancer outreach clinics there. And it evolved. And you get to know the community, the need for specialist care. And it evolved that now I go out to both these communities very regularly. I do both skin cancer outreach clinics, but also I do specialist outreach clinics there as well on a very regular basis. And so we've developed a very nice relationship. But moreover, we do have a very significant population up north. And I think, as we all know, with pandemic, the ability for virtual care has really expanded our ability to access patients in the north, but sometimes that's very limited. Early on in my career with Jack Toole, we went up north and did northern outreach to several communities up north. But more recently, I've reinitiated that, and I've done some remote northern outreach now to some Indigenous reserves up north, and that's something that will be ongoing on an ongoing basis that I'm going to keep doing and have planned moving forward. Because even though I do believe that the virtual care is really important, there are communities that the access is limited, the ability for good connections are limited. And so there's a particular community, the Nishnawbe Cree Nation Nelson House, that I've gone up to a number of times, formed some very good relationships with some of the Indigenous elders there, with the community. It's not far from Thompson, Manitoba, which is very high in the very high north. And so that's a community in which I very much have enjoyed in providing dermatology care to.
Okay. So, I mean, I hear you about the virtual piece, but the diagnostics really do require visits often, right? I find that challenging. So jumping on, this is quite a range of communities you're visiting, but I'm curious, and they're all probably a little different, but can you kind of give an overarching description of what's unique about working in some of these communities that you support compared to an urban center? And how do these unique influences affect your patient care?
So the resources, first of all, when you go there, the patients are so tremendously grateful for the specialist outreach, because it's so unique to have a specialist into a community that doesn't normally get specialist care, and certainly not dermatology specialist care. And it's not just the patients, but it's actually the care providers as well. And it's also a unique opportunity for me and for us to deliver education to these communities as well. So I always try to piggyback it with some educational session as well, regarding some common problems in the community, whether it's atopic dermatitis or psoriasis or something that the community is, skin cancer, something that the community is, or something that they ask for actually. So I think it's a great opportunity for us to really make a difference in that community from the perspective of providing care, but also educating the people there. So people are, it's tremendously grateful. The resources are very limited, and the care provided is, it often is very, there's caregivers up north. They come and they go. It's often delivered by nurse practitioners who are often tremendously good, but overtaxed, delivering care to a very large population. So it's a very different health structure. So it's a very nice thing to be able to go and provide that care.
Yeah, so yeah, it's definitely the care teams start to shift, don't they, when you move out of an urban center, and different kinds of models, and sometimes no physicians for a little while. So it's interesting to work with nurses and sometimes social workers are sometimes the only people in certain communities. But so I appreciate what you say about patient gratitude. I find that really compelling with some of our patients who don't get care easily. But apart from that, any other pieces of these communities that you find particularly rewarding?
A few things. Well, first of all, you actually see patients who probably would never ever come to specialist care, either because their comfort outside the community is, they don't have comfort outside the community, or they would never have a referral sent outside the community. So I think that's very impactful. But also to go to the community and see the culture in which the patients live is, for me, very enriching, and I think makes me a better healthcare provider. To see the to see the environment in which people are living, to talk to the community, to talk to the healthcare providers, and to look at the context in which care is normally being provided, I think is invaluable, and makes me as a dermatologist a better dermatologist and provide better care to our patients.
Yeah, it must be really interesting to see some of these settings, and I suppose that is a springboard to my next question, which is what are some of the unique challenges you find delivering medical care in these communities for the patients and for yourself?
Well, I think that there's so many challenges. Well, the first of all is access to care in general. So, I see somebody and I want to do a follow-up with that patient, and I have to be sensitive to the fact that, well, when am I going to be next in the community, and how will that follow-up happen, and who's going to do that follow-up if it's not going to be me? And so that's all very, so when going up to particularly a northern remote community, those are all important things, because some people can be a one-time visit, but often in the context of chronic care, it's chronic care. So I want to make sure that that can be in place, because that's providing care for somebody. And so if somebody does not have the ability for example, a follow-up virtual call, that's impactful. If there's no healthcare providers in the community, that's very impactful. Even the delivery of medication on a regular basis can become an issue, and particularly with harsh northern environments and weather, delivery of medication sometimes actually is a big issue, and getting medication into the community can be communities can be a problem on a regular basis, with refill and the need for ongoing care. So those are actually some big limitations, but also providing care in the context of being very culturally sensitive is important. So understanding interpretation of disease in the context of interpreting in the context of cultural understanding is very important. Incorporating traditional medicines in the context of indigenous population, and understanding what our indigenous population is using, because that's very important. And many of the indigenous medications have a big role in care of our patients. And an important role. And I think that incorporating those, that's very important to understand what people are using. And we actually have a little bit of research that shows that some people are not really willing to discuss it because maybe they don't feel that we accept that. Whereas I want people to know that I do want to hear about that. And I want to know what people are using. And a lot of those, what they're using, like bear grease, that's okay to use and may really benefit people. So I think it's
Mhm.
important for people to have the comfort to know that and to be able to discuss that. So, um,
Any kind of engagement in their own care
that
is
engagement in their
encouraged,
own
right?
community,
Yeah,
I think that by going to a community and having that discussion is, I think it's important, and people can see that that commitment is there. And I think
very
that
holistic.
it's really
Yeah.
been very well accepted, and people have been very happy to have that engagement in the community. I wish that I could multiply it 1,000 times, I'll be honest with you, but I can't. I
So my
can't.
next question then is a point of discussing like what resources are or supports are lacking for you to deliver even more extended care to the areas that you're already working with.
Yeah. So that would be a full-time job multiplied by 100, quite honestly. There would need to be multiple people doing it on a full-time basis, I think, to reach the communities we need. But
Mm.
I do believe that there can be trained physician extenders to do a better job than the happening. I think that we, as dermatologists, can do a better job training our physician extenders who are already in the community to recognize disease, to manage disease better. I think that we have to have programs that are um, executed and followed up. I think we have to have programs that are that connections of people forming communities who can discuss problems, to troubleshoot and have ability to talk about
Mm.
things. Now, I know that there's a lot of other healthcare issues to talk about too, but truly and honestly,
Mhm.
skin is a big one.
And
And
that my experience is that there's a longevity of any one practitioner in these communities is very unstable. So that, right? Yeah. And
that's
that's the
true.
tricky
That's
piece.
true.
So
There are some practitioners in the community who've been there quite a long time, who have an interest. And even if longevity isn't as even if one practitioner isn't there a long time, even to educate that practitioner to go wherever that practitioner may go,
sure, absolutely. You're
that's
right.
okay,
Yeah.
right?
I
Where
love
they're
the
going to take that
education.
education wherever they may go.
Hmm. I think you're offering unique educational opportunity. I'm not, I think that's a great piggyback onto what you're already providing because it's like a piece of you stays behind, right?
It's very true. And so that's why when I go, I try to educate. Like, last time we did a
Leave
great
something
atopic
behind.
dermatitis
Mhm.
education to talk about, how we provide prescription volume, and we talked about vehicle, and we talked
Mhm.
about chronicity of disease and the importance of refills, just so that it
Mhm.
would resonate. And so wherever, even
Absolutely.
if that person leaves the community, they'll take those messages with them. So I was hoping that that would be something. And the questions were great, and there was a
Mhm.
huge audience who listened. That was the last time I was there, and I thought it was a very impactful discussions that we had with the community. So
So shifting gears a bit, what kind of incentives, be it financial, educational, professional, personal, what sort of incentives would encourage more dermatology specialists to work in rural areas, in your opinion?
it's a very important question because it we really do need people to take their practice and move up, and take some of their practice at least to move up north, if not all of it. And I think that the reward that one gets from an experience up north is actually truly and honestly payment in itself. So I think that if we can have a learner piggyback with a dermatologist in the experience of a northern clinic, that would really resonate with the learner to see the impact of what northern health is like, or remote rural health or rural health. And so, for example, so for what you see, so there's so much pathology that's seen too. It's not, there's so many interesting things that are seen even in the course of a day. So, you see just different and exciting things, and managing so many, unique and interesting things as well, because, you're it. So it's not just providing care for people who really need care, it's providing care and seeing really cool stuff. So I think
Mm-hmm.
if learners could get a taste of that, I think that would resonate with them. So I do believe in educational programs. It should be rolled into the educational program of residency to
Mm-hmm.
get experience, mandatory experience in rural, remote, northern environments, because I do believe that would kind of give people a taste of it and would encourage them to want to incorporate that into their practice.
Mm-hmm. Yeah, I'm hearing that over and over again. And I think it's a really, obviously, a very important piece is the exposure, so that, without it, you'll have no vision for the role. What advice would you give to a dermatology resident who is considering setting up a practice in a more rural community? Is that something do you feel that you could speak towards?
I'm not sure if I could give particular advice other than to say that they should go to the community, find out what the needs are, and talk to the community about location and needs and all that kind of stuff. Normally, when I find when somebody sets up in a rural remote community, it's a community that they know they have experience with, or they found out a little bit about.
Mm-hmm.
It wouldn't be you know, going somewhere cold that they know nothing about. Um, or they know someone who's been there.
Mm-hmm.
So I think that doing the research ahead of time to maximize practice success would be very key, but also to talk to other people in a similar situation to find out what works and what doesn't work is very important as well.
Very different environment for sure. Any comments on how you feel the CDA could support rural dermatology care in Canada?
Sometimes practicing in Winnipeg, we're not a huge center of dermatologists. We're very limited. We have big wait lists, and I would assume that people who practice exclusively in very isolated or remote areas as well also would feel that they have, they would want to make sure that they have a balanced life. And I think that's very important, that they're connected with their colleagues. And I think that the Canadian Dermatology Association, it would be a very good initiative, if it doesn't exist already, and I don't think it does, to form practice connections amongst those people. Because I have my colleagues here who we connect every month, but to form even a remote or rural dermatology connection. So perhaps those dermatologists, whatever province they may be in, who may be more isolated, can form their group
Mm-hmm.
and connect, whether it's probably virtually, to connect about maybe their unique challenges, to maybe form an academic group, to connect monthly journal clubs, to connect about their, troubleshoot what because there would be similar issues and maybe different ones, but to have maybe a remote or rural group of dermatologists who can communicate.
Love that. It's a great idea. Wonderful. Thank you, Marni. In closing, I just want to let you know that your ideas are really interesting and great reflections. All of this work, I'm looking to speak to people across the country who work in different remote areas for dermatology care, and this information will help with our advocacy movement within the organization as well, and should hopefully help all dermatology care in Canada. So thank you very much for your time today.
And thank you for this initiative. I think it's very important.
Thank you.